Linda, a patient of Dr. Haddock's. Dr. Haddock has actually been there every step of the way through my treatment process from a surgical standpoint and from a consultation standpoint. He's been absolutely fantastic. I had the DIEP flap and I don't have any complaints from anybody, and they all seem to think it looks quite natural, and frankly, I think it does. Other than being pretty invasive from the standpoint of being cut hip to hip, it is a process and you have to remain in the moment, not 6 months down the road, but really remain in the process and understand that this too shall pass. And when you come out on the other side, it is as close to you as you can possibly be. At least for me, from the standpoint that I was, because I had the nipple sparing and the way that Dr. Leach had done her surgical incisions for the bilateral mastectomy. And Dr. Haddock was right there, ready to do his part of it. Whenever we first started the process, I really thought that we were going to go in, tissue expanders were going to come out, and we'd be done, all done. And then I learned after that, obviously, no, if you're going to do this, there is some, there's some fat grafting that has to be done and things like that if you're thin, like I am. But for me, I just think that this has a much more natural look to me. It makes me feel like I'm still me, which is really important in all this process, that you not lose yourself as part of the process, and be your best patient advocate, best health advocate, because frankly, nobody's gonna know you like you know you, right? It's really important to have that symbiotic kind of relationship with your surgeon and your doctor, and I think that Dr. Haddock absolutely is that. He's always struck me as being that, as what is it that you want as your outcome? How can I make you feel better? How can I bring you back to where you were before? I just think that if you get more involved and understand what's happening, you're less surprised at the end. You have more something that is what you want, and something that I think that feels like, hey, I'm coming out of this not as a victim. I'm coming out of this as a newly revised, refreshed, rejuvenated person. He's on the cutting edge, so he's always doing something new. I mean, he's doing new things since he did my surgery. So I know that there's other types that are out there, but it all revolves around using your own tissue. And I think that that's a fantastic thing. So I think the person needs to ask, this is what I think that I would like to have happen. This is what I would like to look like at the end, or what I'd like to be able to do. But a lot of patients will come into their very first visit of not really having a clue of what this means, where the steps are. Nobody says, hey, this is what to expect when you go to see your plastic surgeon or your oncologist. Is there a lot of pain involved? What's your pain threshold? If you can get into your zen and happy place when you're ready to actually go into it and think about what it's going to be afterwards, no pain kind of thing, I think it really does seem to help, at least it helped me. And knowing that when I was going in, the one thing that I could rely on is that I trusted implicitly in my doctor, and Dr. Haddock has my absolute confidence. Cancer patient is more than likely at a position where they've just had their cancer taken out and they're relieved with that. But they may have gone through chemotherapy, they may have gone through radiation before they ended up at Dr. Haddock. And so, sometimes you can get that beat up kind of feeling before you actually get there. And I will say that he's just very nurturing in how he talks to us and how he interacts. For me, I wanted somebody that was really cutting edge, somebody that wanted to push forward, and the things that Dr. Haddock had in his bio and things like that, where he said that, it's all about the patient, and getting them to the point where they want to be, to help them to be like they were before, feel good about where they are and things like that. And I didn't have to look any farther. To me, that checked all of my boxes. And I can't say enough fantastic things about Dr. Haddock. I mean, from his bedside manner to his follow-up, to the care and concern that he has in checking on his patients and, getting to know them. Well, I tell him every time that I see him, I really appreciate all that Dr. Haddock does. And again, I think that he's the type of individual that is in it for the right reason. I have never seen somebody working so many hours as he does. He is like always on, and he always brings such a priority to each patient to make us feel so special. And I really, truly appreciate that. I appreciate the knowledge and the willingness to share with others, to help them come along too, so that others can have really good results like I did. It's fantastic that he's had incredible success in each one of these types of procedures. I just thank you, Dr. Haddock. I think that you're fantastic. And I've said it before and I'll say it again, you are awesome. You rock.